Hi, good afternoon, everybody. Welcome to the Global Learning Office's GLOVicariously webinar series. Today's topic is political, public health, and psychosocial impacts of COVID-19 in the former Yugoslavia. To introduce our speaker today, we have a student alum from the Comparative Public Health in Serbia and Bosnia-Herzegovina program, Martin Herman. Martin is a junior studying global health studies and Slavic languages and literature. And I'm going to turn it over to Martin.
Hey, thank you for joining us today. This webinar will last approximately 1 hour with a presentation followed by a Q&A. All participants will remain muted, so feel free to send any questions to the chat Q&A and we'll collect them and answer after the presentation. You're welcome to turn on your cameras or you can keep them off, your choice. We'll also launch a quick poll at the end, so be ready for that. And now I want to introduce today's speakers and moderators. First off, we have Ivan Đorđević, who is an anthropologist and research associate at the Institute of Ethnography in Belgrade, Serbia. He holds a PhD in anthropology from the University of Belgrade, and his recent work is mainly focused on health issues related to disadvantaged Roma communities in Serbia and neighboring countries. In 2018 and 19, he was a contributor and co-coordinator of the Northwestern Global Learning Office program Comparative Public Health in Serbia and Bosnia-Herzegovina. During spring quarter 2020, he served as the first Radulovački visiting scholar in global health studies at Northwestern, teaching a course titled Healthcare Under Socialism and Post-Socialism. Next up, we have Nemanja Đuvarović, who is an associate professor in peace studies at the University of Belgrade, and his research areas include the inequality-conflict nexus, welfare in post-conflict societies, environments, and the political economy of liberal peace building and international state building in the Balkans. Nemanja is the co-coordinator of the Comparative Public Health program, and in the past academic year, Nemanja was also a Fulbright visiting scholar at Northwestern University, and he was teaching the course Peace Building, Conflict, and Public Health as part of the Global Health Studies program, which I was lucky enough to be a part of. Lastly, we have Marija Šarić, or Maya, as we call her. She's the director of the Psychosocial support service organization Wings of Hope for over a decade now. Maya has been working in the Bosnian civil society sector to support vulnerable and war-impacted families since the early 1990s. She has degrees in a million different things, actually, amongst them in economics, sociology, philosophy, peace studies, and psychotraumatology, and has worked in numerous consulting and advising roles for NGOs, government ministries, and international organizations throughout her career. Lastly, our moderator is Peter Locke, who is cultural and medical anthropologist, focused on bringing ethnographic evidence to the comparative study of global health and humanitarian intervention in post-conflict societies. A very long sentence, sorry. His field research, writing, and teaching all explore and critique the intersection of humanitarian work and reigning modes of evidence production in contexts of contentious local politics and lingering histories of conflict and mass violence. He's currently an assistant professor of instruction and co-director of the undergraduate studies in the Global Health Studies program at Northwestern. And Peter also serves as the program director for the Comparative Public Health Study program that we mentioned earlier in Serbia and Bosnia-Herzegovina. I'm going to give it off to Peter now, and I think we're starting now.
Okay, thank you everyone, and Whitney and Martin especially. It's really been a pleasure and a privilege for me over the last few years to organize this new study abroad program for Northwestern Global Health students based in Belgrade and in Sarajevo in Bosnia, places where I have a long history of visiting and becoming entangled in a variety of ways. And Ivan, Nemanja, and Maya have been incredibly important as instructors and collaborators for that program, and I have really been lucky to work with them and really lucky to give my students the chance to learn from them as well. So to start off with, we envisioned this hour is really a conversation more than a formal presentation. So I'll ask a few questions along the way, and as Martin and Whitney mentioned, you can use the those of you in the audience can use the chat function to send in questions that our panelists can field or respond to in the last 15 or 20 minutes of the panel. The first question I wanted to throw out to all three of you, each of you could answer or not as you like, but just a kind of softball question before we get to the hard ones about the coronavirus pandemic. What are some aspects to each of your minds about participating in our summer study abroad program, which is now run for 4 years, with the exception of this last summer, of course, because of the pandemic? What are some aspects of being part of that program, of teaching and of working with our students, that you found rewarding and interesting in your own lives and careers? Can everybody hear? Did I just say all those things with...
No, you just turned off the microphone before you finished the sentence. So that's why we were confused. So, okay.
Yeah,
I can
go
start.
ahead.
Okay. Thank you. Hi, everyone, and thank you very much for participating here. I'm really, really happy to see you all and to be part of this webinar and to at least meet you in this way. But this is like so far the best we can. Okay, like for me, the experience with the summer school and the Northwestern students is really rewarding in terms of that I didn't have opportunity so far to work with the students from the US, and for me it was a pure joy. Especially when I started with the summer program. Now I have a bit more experience teaching a course at Northwestern, and my opinion on Northwestern students is even better if it is possible. On the other hand, the system of work that Northwestern uses in their study abroad programs is something that I learned a lot from, and that is something I really use in my everyday work, as something that I find really, really kind of useful and very student-oriented, which I appreciate a lot. So thank you.
Okay, should I go next, Maya? Okay, hello everyone. Great to see so many familiar faces. I'm sorry I missed many of you while I was in Chicago, but it's great to see you at least in this way. And thank you for inviting me for this webinar. I really like the opportunity to talk about this. Well, every year I have the same impression. Like beginning of June, there is a impression like, oh, I need to teach one more week, like the whole day, every day. But then like the first day starts and immediately get very comfortable with all of you, right? So it's very nice, friendly feeling whenever I'm in the classroom with American students. And as many of you, and maybe all of you probably know, I teach politics in the Balkans. And that's very controversial topic when you come, if you are from America and the Balkan, right? And I really like controversial topics. So I think I enjoy this clash of different perception, mine being from the local, having one perspective, and American students who have very different perspective when they first come to the region. But what is even more interesting to see how you kind of change your perception from like first week until the 8th week or 6th week, depending when we see each other, and how you kind of, while you will learn about the region, how you change your perception, not only about the region, but the whole world, right? Because if you come from the global north and you come to global south, there is one way how you look at the things. But by the end of the school, I think most of you kind of have different idea how things work. So I really like to see this transformation in students. And it happens, I think, every year without exception with, I think, all of you, right? So this kind of transformation is something that I really enjoy. And I, of course, enjoy really our discussions. Somehow it's, maybe I'm biased, but for me, they're more productive than discussions that I have with my students. Maybe they're just fed up with me seeing every day for the whole year, right? But somehow students from Northwestern, they're always engaged, they're always interested. There are so many new things discovering, right? So kind of these post-class discussions are things that I equally enjoy as our in-class talks when we have them.
So I guess it's my turn. I'm so happy to see you all. I saw so many nice people I have met in past few years, and I'm glad that you are joining this webinar as well. I'm kind of sad because we had this kind of situation that no one can visit us this year. I have kind of easy job. Students learn lots of stuff during those 2 months that they are staying in Serbia and Bosnia and Herzegovina. And then I have the best, like the last 3 days. And then we reconstruct all misconceptions that they have had about, especially conflict in ex-Yugoslavia, different ethnicity issues, different health, public health bragging about ex-Yugoslavia. Maybe it was, I mean, public health was really good when I was growing up, but it's definitely not good now. And my job is as well to support the students who are coming to area of ex-Yugoslavia, and then if they have issues, I'm the ear that can hear what kind of problems they have. So I really, really hope that next year Peter will come together with the students. I believe it's really good program. And for me, when I was young, was extremely important to travel, to see other cultures, to live in other cultures, and to see how different the other culture is. For example, last year I was in the United States visiting Chicago, and I was talking about toilets for about a month, because that was the weirdest thing for me ever. So.
Thanks all three of you for those wonderful responses, and again for your commitment to an enjoyment of the program over the years. So now on to the tougher scholarly questions about the pandemic and how it's playing out differently in our different contexts. So I know it's hard to avoid the news right now of how bad the situation is in the U.S., for example, but I think most people in America are very, regardless of the pandemic, tend to be relatively unaware of global issues and how situations or shared situations like the pandemic are playing out in other parts of the world. Certainly most Americans are not thinking about Southeast Europe right now or have any sense of how politics and the pandemic are different there, and how they're playing out in relation to your own cultures, your own forms of governance and politics, and your own histories. So to get to the question, all of you or a couple of you could answer this. Could you give us your quick sense of what the situation is in your respective countries right now, Serbia and Bosnia-Herzegovina, in relation to the COVID pandemic? How bad is it? How big is it? And how are your systems from health to governance and politics? How are they responding to it? Don't all jump in at once.
Okay, I can start again. I can kick off. Actually, what is happening here in Serbia? Like, situation now is, we hope, better than it used to be, like I don't know, 2 weeks ago. But what is definitely a characteristic of our situation in Belgrade and Serbia is actually the data are not reliable, in a way that health issues are deeply intertwined with politics. So we had a situation in June that actually the elections that were supposed to be organized were the reason why we all thought that our numbers are decreasing rapidly. And in that terms, after we realized after the elections that actually situation was much, much worse, and the data we got and through official channels of communication were not really reliable, now we don't know what to think. And now when we are expecting the beginning of a new school year and coming back to work and to kindergartens and everything else, we just feel confused. And that is how I would describe the whole pandemic situation in Serbia. People are basically and mainly confused. That would be my 2 cents for the beginning.
Okay, maybe I should jump in. To be honest, I feel great because I have been I have been for 3 months in the US during pandemic, and coming back to Serbia was kind of a relief for me. I'm guessing that's very subjective feeling, right? But being in the US, it's actually, I'm guessing, the worst place where you want to be. So when I came back, of course, because the way we talk, and I can actually talk about that afterwards, like the way how we approach the whole pandemic is very different than in the US. And the sense, like when you are out there, it's a kind of normal life, whatever normal is now. Of course, we understand that it's not reliable, but I think comparing situation with the US, I would feel that situation here is better, right? Just not looking only at the numbers and looking at the whole approach, but just kind of the feeling being in Serbia, for me, it's better than being in the US during the pandemic. And as I said, this is very subjective feeling that I have, but maybe this is nice to share. Maybe later on I can just talk about how different I see these two approaches, or at least how people differently behave in Serbia and US during pandemics, and which for me it's more interesting than the data itself.
You can go ahead and talk about that now if you want, Naman.
Okay, sure. Okay, so maybe some of you, probably all of you, know that I have been in the US for until mid of June. So that's been like 3 months. And since then, I have been here. So, and I can talk on and on. And I think I bored some of you who are online here about cultural differences, but maybe I can just talk about two, because I think that just my perception that because most people in US live very comfortable life, right? And of course, understand that not everybody live that life, and that poverty and inequality are a big issue, but still comparing with countries from global south, for us, this looks as a very comfortable life. And it seems to me that every disruption in this lifestyle causing a kind of anxiety and trauma, right? And COVID pandemic being like the biggest distraction or disruption since the Second World War is, I think, causing so much trauma and anxiety in the US, right? While here, because of everything that we've been through, maybe Maya will talk more, because of the war, forced migration, killings and everything, it seems to me that we take this as a yet another inconvenience. Not the minor one, but at least not the biggest, and not really on priority in the long term, right? So I think we approach this in a very different way. And the other thing that kind of, and this strikes me, I think Martin can talk maybe because he lives as European in the US, but I think US is very individualistic society, right? And this is something that I never got accustomed by when I was living there. Basically, it's expected from you to do everything by yourself, right? And this is of course normal, and I think in US period, this is actually something, one of the most valuable things that you have. But if you come from collective society as we do, right, we actually expect, and we have this kind of informal and formal groups that help us. They are kind of our safety nets, our security. So if you have some problems, especially during pandemics, right, you can always turn to these kind of groups that you have. While in the US, I think you are basically on your own, of course, with your family, but basically you need to take care of yourself. While here, you kind of expect that surrounding will also take care of you. So I think that would be kind of two things that kind of struck me while being in the US and being now here, that just because of the context, which is very different in the Balkans and US, I think we see pandemics differently, right? And this is not really saying that it's not a threat, but just kind of how we approach that is very different. And our approach has good and bad sides. I think in a good way, I think we have, well, I don't know if this is the right word, but healthier approach. But then on the bad side is actually we take things for granted, and we are quite irresponsible when it comes to pandemics. We don't follow advices. We don't listen actually to public health experts, because we kind of, it's going to go away, right? So there's kind of pro and cons for both approach. But I think because of this kind of responsible approach that we have these problems that Ivan was talking about. But I think it's also culturally determined and not really data determined. That's what I wanted to say.
So I guess it's my turn. Nemanja already said, because of the war, siege of Sarajevo, we understood pandemic a little bit differently. We have reoccurring traumas, especially when, let's say, approximately about 60% of Bosnian and Herzegovinian population, because we had the war on 99% of the territory, have developed some signs of post-traumatic stress disorder, because we have first-hand traumatization, second-hand traumatization, and people got really scared. So what we from Wings of Hope did immediately, we offered the emergency numbers so that people could call, and we've been offering free consulting services, especially for 3 months of isolation, which we had from March till, let's say, beginning of June. Then, because of the numbers were not jumping, which is now not the case, and we had period of Ramadan, our crisis I don't know, Stab headquarters decided to make the rules lenient, and then now we have different clusters and we have more people who are getting infected. However, our healthcare system is totally crazy. We have 2 hospitals, especially in Sarajevo situation, 2 hospitals which are fighting. You can't get any kind of surgery, you have to get tested, so they are actually denying people surgeries which they need. They are even issuing fake COVID tests so that people test positive so that they don't have to operate on them. I am at the moment in isolation because my husband went to the mountains. He ate bad burak. Burak is a pie with the meat, who was in Sarajevo tried it. And he got fever and diarrhea. He went to the doctor, and doctor ordered isolation to him and to me, and they will test him tomorrow. Like, this is completely, you don't get tested immediately. Of course, I've checked all his symptoms. He had fever only on Sunday. So it was classical food poisoning. But now, here in Sarajevo, first-hand experience, whatever fever you get, they assume it's COVID. You have to go to isolation. There is no other illness but COVID. The problem, the biggest problem is that we don't have enough information. We have too many information. We've been joking about flat earthers, about, I don't know, 5G, about Russian vaccines. Like, you have so much information, it's impossible to figure out what's right and what's not right. Apparently, COVID symptoms are any kind of the sickness that you have. It's always, whenever it's fever, you have to stay isolated. And I know people who had to stay isolated 3 times till now, and it's always 14 days. And police is checking on you. So they come to your door to check if you are staying inside of the house. People are panicking. Probably the biggest problem is not knowing. You have to queue in front of the post offices, in front of the banks, in front of the, I don't know, pharmacies. If you are buying paracetamol, which was a long time ago, totally normal, they look at you suspiciously. Some people are saying it's worse for them now than during the war, which is not right. And then, like, because I'm a therapist as well, and I work with lots of people, there is lots of confusion. Like Nemanja said, there is lots of mistrust. You can see how bad people are reacting to the crisis situations, and lots of people have need lots of help. And we have additional issues, and this is that our neighbor countries opened borders, and we have the biggest border in Europe with European Union, which is our next neighbor, Croatia. And we have huge issues with immigrants. The problem is that supplies for immigrants are slowly depleted, and the prices for food are getting higher. And so like the suppliers can't supply them because like all truck drivers have to get special COVID tests, and they have to stay in isolation every time they come back from their trips. So we are getting more and more refugees and immigrants, and we have less and less food to feed them, and nobody's doing anything about that. So we have xenophobia, we are suspicious about our neighbors, we are turning into the Big Brother, if anyone has been reading Orwell's book, like in 1994. So it's like if you sneeze, if you have allergy, you have COVID and stuff like that. So, and people are becoming aggressive. So I'm not sure that we are dealing with the whole situation better than anyone else. That's about it, I think.
Thank you. This was already just fascinating, and I thought of about 15 follow-up questions as the three of you were speaking, but we'll have to restrain myself. The first thing I want to pick up on here between your three contributions is what seems to be a contrast in cultural or popular reactions to the pandemic between Serbia and Bosnia. Right. So whereas Nemanja said we're a little bit more relaxed about this compared to what he saw in the U.S. because of what we have been through as a region, decades of upheaval and political difficulties and war and economic challenges, etc. The pandemic seems like, okay, this is another inconvenience. So that's one relationship to the trauma of the last 30 or 40 years in the region, right? That the pandemic doesn't look so bad by comparison to that experience. But then what we're hearing from Maya in Bosnia is kind of the inverse relationship to that history. The way you put it, Maya, is that trauma is so widespread. There was conflict on 99% of Bosnian territory. What I heard over and over again during the time that I spent in Bosnia and in Sarajevo, that everyone is traumatized or has some aspect of PTSD there. From your point of view, that seems to have exacerbated or increased anxiety and fear and panic around the pandemic in Bosnia or in Sarajevo in particular. So I wonder what the three of you, if the three of you just might want to think about that comparison or that contrast now, if that makes sense to you, if there's something to that there could be something different. We want to talk about the region as a whole and sort of cultural and political patterns across the region. But this seems like a really interesting contrast between Serbia and Bosnia in terms of the reactions.
What I was thinking while Nemanja and Maya were talking is that basically I would say that they're both right. In the beginning of the pandemic in Serbia, reaction was like, we are tough, we passed so many things before, and this will be just like one of the many troubles we have to face. But as it didn't stop as we expected after 2 months, things changed a lot. And from very enthusiastic beginning in terms of how well we are equipped to face the crisis, now we are basically facing the same what everyone else is facing. So like anxieties and fighting against the invisible enemy. That is something I was thinking about a lot. In like past crisis, like we all know what we are talking about. We all somehow had an enemy. For example, like during the NATO bombing, which Serbs love to compare this crisis to. During NATO bombing, people were seeing airplanes, seeing bombs, and like feeling that there is a reason to show solidarity. But now, when you have an invisible enemy, the virus, you can't see it, you can't feel it, and if you're not, or someone close to you, if he or she is not sick, then you don't feel anything is happening actually. But then you see people with masks around you, and you are like listening about people dying in hospital. You, as Maya put it, and it's the same here, you can't get in like even the simplest intervention in the hospital right now. Everything is about COVID, and everything is on COVID. So now you can see that people are getting more and more anxious about what to do with kids now, with the kindergarten, with schools. You have really hot debates on social networks. And yeah, as Maya mentioned, here as well, becoming aggressive. So that's something I'm thinking about, like talking. And I would say, of course, like trauma in Sarajevo is much bigger than in Serbia. And it's not like, there is no doubt about that. And PTSD and like 4 years of siege and the whole territory of Bosnia and Herzegovina, Bosnia faced like much worse scenario than Serbia did. But there is also PTSD in Serbia. And somehow our reaction was like to show how tough we are. And now our reaction is like somewhere between denial and anxiety, if like if this makes sense.
If I can jump in, yeah, there is PTSD in Serbia because we were in war. I think the biggest problem as well in Serbia is that Serbia officially doesn't recognize that people from Serbia were fighting in Bosnia or in Kosovo. And that people are denying actually post-traumatic stress of veterans, that they are not recognizing the veterans, and those people really, really need help. So you can imagine now, I don't know how many suicide has happened. I was not counting actually in past 3 months, but I think very often has happened that one person with PTSD, recently somebody who was 60 killed his wife, and obviously this person was there during the war, was mobilized and was fighting. So he killed his wife and killed himself just like past week. And I think it happened, several cases happened in Serbia, several cases happened in Bosnia, and few cases happened in Croatia as well. And one thing that we forgot to mention, lots of people lost their jobs. And those were like super secure jobs, like waiter, like hairdresser. The dentist stopped working because it was totally forbidden for dentists to work. So you couldn't even get the simplest, the most simple dentist procedure, which could be really dangerous and bring to complications. So I don't know, I think through the more this goes, we will have more and more issues and more problems. And I'm talking about people who have to be separated from the loved ones. This is as well the issue. Especially we have a huge diaspora, Serbia and Bosnia and Herzegovina, all over Europe, but our countries are blacklisted. So you have to go to the quarantine and isolation if you decide to travel anywhere in this region. So I think this is as well additional issue. So our economy will go down badly, and we didn't have the good one anyway.
Well, I think I'm perfectly aware that my kind of perception is very biased one, but I would kind of still hold my ground and still think that way we react here is much more relaxed than people in the US, maybe because I've seen that, but also I will give just two kind of example. Last 10 days or so, I had to go a couple of times to ER. My mom broke her ankle. Believe it or not, most doctors do not wear masks in ER in Belgrade. during pandemic. I was so surprised to see that most patients, almost all of the patients do wear masks. Doctors, from what I have seen, and I have seen maybe like 7 or 8 doctors, most of them didn't wear any kind of protection, right? Half of my students do not want to wear masks, even if, right? You see people, I have to use public transportation every day. You see people, like half of them now, with numbers going down, half of them do not wear masks, or they wear it as a fashion statement, you know, like putting it here, just like, I don't know why they use it. So just being there, being in the US, to see how aware they are and how we react, I would still think that our reaction is very different than the one in the US, just because I had opportunity, unfortunately, to witness on both accounts how we react as individuals.
I would also, the comparison and contrast between Serbian and Bosnian reactions is just fascinating, but I would completely also agree with Nemanja's point that there are major cultural, social, and historical determinants of our collective reactions that are extremely different between the US and between the former Yugoslavia. And certainly I have felt that quite strongly, that there is enormous anxiety and panic in the U.S. about this that can be linked to some of the things that each of you have been discussing that makes our reaction quite different and perhaps more panicked, for good or for ill, vis-a-vis what's going on. But again, those subtleties and the differences between Serbia and Bosnia are really interesting. We're probably only going to have time for a couple more, 1 or 2 more questions from me before we make sure that those in the audience have a chance to pose some questions as well, if they've been sending them along to Jessica and Martin. So the 2 points that I want to be sure, and maybe you can even take these together, or somebody could handle one point and someone another one, that I want to be sure that we hit are: number 1, health system responses and the role of public health experts in each of your contexts, right? So our summer program, the curriculum focuses a lot on the history of public health and of your health systems in the region, from the socialized medicine of Yugoslavia to the universal healthcare programs of the post-Yugoslav neoliberal era. And as Maya mentioned, because we work with the medical school and institutions of public health in each country, there's a lot of kind of public health bragging. That is, compared to the US, where your system is so unequal, so capitalistic, so exploitative, so expensive, we have this long history of socialized medicine that is very effective. But we know that all health systems have weaknesses, right? So what to each of your minds would be some of the weaknesses of your health systems that have been thrown into relief or made really clear by the pandemic? And then the second kind of corollary question to that, maybe it's actually an answer to that question that I asked, picks up on something that Maya and Ivan have both mentioned about vulnerable populations. So, for example, the Roma in your region, we're seeing in the U.S., of course, that the pandemic is affecting our most vulnerable, our most disempowered, our most exploited populations at 2 or 3 times the degree of more privileged populations, right? Black folks getting infected and dying in the U.S. at 2 or 3 times the rate compared to the rest of the general population. So how does that picture look in your region, in Serbia and Bosnia? Maybe we're thinking about the Roma, especially in both countries, and then in Bosnia, because of migrants from North Africa and the Middle East who have been passing through there trying to get to Croatia. They must be one of the most vulnerable populations there. So how are those populations being affected? Do you have a good sense of how? Do you even have good transparent data about this? And again, how are health systems and politics responding? A lot there, so take whatever piece of that you would like to.
I will, if I can jump in, I will say just one sentence about our public health system, or leftovers of our socialized public health system from Yugoslavia. The main weakness is its connection with politics. And that's basically what is happening everywhere. But here, we can feel it really, really hard. And on the other hand, leftovers of socialized healthcare system still work. So I wouldn't say that the response is really like utterly bad and people are getting treatment. But of course, because of lack of funding and everything, equipment is really bad. And on the other hand, like, I didn't know, 80% of hospitals at some point turned out to COVID hospitals. So, and other treatments couldn't be done. And I will switch to what I'm thinking the last couple of days really deeply, because I work with a lot of Roma organizations, and Roma are really like underprivileged, the most underprivileged population in whole Serbia, are living in a segregated communities and being like super underprivileged without jobs. And luckily, because of that segregation, first wave passed without many infections in their settlements and communities. But what happened after the release of home measures, because basically the only way how, and like maybe 70% of them, what they are doing for life is actually like bin diving, collecting trash for trash bins and selling it somewhere. Like, it's super dangerous. And of course, in this second wave, they got infected. Many of them got infected, but it is not known. I know that because I work and collaborate closely with the Roma NGOs here. And what they told me is the situation is not good at all. And the basic problem is their access to healthcare system. They, by constitution, they have right to be treated, but in fact, it's not easy for them even to have an opportunity to come to a hospital to be treated. So what I can say officially, we don't know what is happening, and we will see the results after, unfortunately, like I guess in 6 months or something. And what is also, and what I also want to mention, is that basically nobody is interested in what is happening there. I am now working with some Roma NGOs on some research about child marriages, which is ridiculous, doing that right now during the pandemics. But some of NGOs they want to finish their projects. And then my duty somehow is to provide the safest way how to do that, because they can't refuse to be involved in a program. They will lose like at least some privileges they get from that programs, and they're like scared to that, of course. So my point is that if I can also put one weakness, one really big weakness, but not from a public health system, but a health system as such, is like that inequalities became even bigger, and gaps are now even greater than gaps were big, but now it's even much worse during the pandemic.
Okay, I'm gonna say just two things because it seems that we are running out of time. I kind of fully agree with you, and I would just say about our public health officials. I think, I don't know about other countries, but in Serbia there is a problem of lack of confidence, because in our case it was proven the data was falsified, right? And I think the problem was not really with public health officials. The problem was the data was falsified by the government, and they actually believe government and the data. So once the whole scam was discovered, people first accuse those who are public health officials, right? So I think they are also struggling now to regain this confidence that was already lost. And we know that once you lose confidence, it's very hard to regain. And the second thing is, I think unlike many or most countries in the world, we actually had foreign guidance when it comes to a pandemic, right? And we had literally Chinese public health officials who were in Belgrade giving guidance or giving directions how to deal with this. And that's why we had such strict measures like curfew, limitation of freedom of movement, like lockdowns. And my impression, and I don't have any data to back that, our kind of public health officials didn't really kind of agree with this approach, but they had to get along because it was actually, I think, politics, not really expertise that decided on this issue. So we have this constant problem of our public health official being embroiled in politics and corruption, and it's very hard for them to regain any kind of confidence because people are just, they don't buy what government is telling them. So I think this is the problem that we have, and I don't really see how we can solve this because they're trying, but me personally don't believe anything that I hear anymore. So it's very hard to regain this confidence.
I think that's the problem. Roma population didn't have any issues in the first wave, just like Ivan was mentioning, so luckily. So we don't have official data, we don't have enough data. The immigrant camps are completely closed. I had several immigrants for the clients. They just need the kind of support who managed to run away from Bosnia. They got to Italy, and from Italy, they first sent them back to Slovenia. From Slovenia, they sent them back to Croatia. In Croatia, they took their phones and the money which they had, they destroyed it, and then sent them back to Bosnia because the Bosnia was the last destination they have been in. European Union doesn't want immigrants, and we are getting more and more of them. The borders are open between, like the borders for immigrants are open. So immigrants, I actually find out they go to Turkey. From Turkey, they go to Greece. From Greece, they push them to Macedonia. From Macedonia, they go either to Serbia or Montenegro, and then all of them come to Bosnia. We can't get any data, and the problem is that those people who were returned to Bosnia are not allowed to go back to the camps, which are run by IOM, that's International Office for Immigration. The same problem is happening when it comes to corruption. Like international institutions are as well corrupted, let's say. So, for example, IOM gets 40 millions. 80% of that money goes for the salaries of officials who are working for IOM. 10% goes for support of immigrants. That's the problem. And IOM is like huge international NGO. So this is an issue, and this is what's happening all the time. And now everyone is getting, for example, we applied for COVID grant because we are NGO. The only institution from Bosnia and Herzegovina who got COVID grant was trade chamber from Republika Srpska. So it was not, trade chamber is not NGO, it's an official government organization who got, and that was the only, and this was EU Commission money. So the corruption exists on all levels. I don't know, our government bought respirators for 10 millions, which were wrong one, and I think Raspberry producer bought those respirators, and our biggest problem is that the wife of the former president is running the hospital, and she wants to be the first and the last one in the whole story. And she decides who is going to live and who is going to die. And I think we are not, I don't think that we are genetically different, Bosnians and Serbs. I think we are exactly the same. But I think we are so broken that we don't complain anymore. We don't have any strength to fight back. And that's basically it.
So we just have a couple minutes left, but it sounds like Martin has managed to collect a fair number of questions from our audience. So hopefully we can take a few minutes for those.
Sure. So with the first one. I read a study that said around 30% of youth in Bosnia would want a more authoritarian singular president if it meant things got done in the country. Do you see this tendency right now in the pandemic towards wanting a government to take control to curb the panic and the virus, even if it means restricted liberties?
No. I don't think that we would prefer to have one president, but I don't know how, because we've been separated in 2 and the 4, like 3 ethnicity groups, and the 4th is unrecognized. Those are Bosnian. Like the country is called Bosnia and Herzegovina, but Bosnians and Herzegovinians are not recognized as nationality. So I don't see this happening. We have pre-election period now. The elections will happen. How they will happen, I don't know. And those are local elections, which people can influence a little bit more. I don't think that any liberty can be taken from us anymore, because this is already a crap. So I don't know if I have answered the question.
Is there anything that Ivan or Nemanja want to say, or we can also just move on? No? Okay.
I can just give anecdotal evidence that I think most people in Serbia actually support this kind of one strong leader who makes all the decision, because ours are making all the decision from strategic partnership with US until, like the type of bandages in hospitals. And it seems to me that people actually support this kind of, from what I hear, right? Not all of them, but those who do vote actually like this kind of authoritarian style.
Honestly, I think we have the only chance for us to survive is to become Yugoslavia again. Then we will have enough food.
Next question. Maya talked briefly about how police check in on folks while they quarantine and the social taboo of sneezing in public. Do you think that these things have worked towards criminalizing disease? And if yes, how has that impacted the ways people seek medical help nowadays?
Yes, people are trying to be responsible, but some people are hiding that they have any health issues so that people don't act discriminatory against them. And yes, this is like, I think issue is that we really don't know, like we are talking about the virus and nobody knows anything about this virus. It's like Ivan said, it's hidden enemy, and any kind of symptoms can be COVID symptoms.
I think it's not criminalizing. It's more like transferring responsibility from the state to the individual. And that's something which is happening all the time, because state doesn't want to take responsibility for health measures, or if they do, they are trying to escape from full responsibility and trying to transfer it to us as a citizens. So that's why I think this is everything like that is happening.
But I do still think that there is a stigma revolving around. I think unlike in US, where the people openly talk about the experience if they get COVID, right? In Serbia, it's, I think, very much stigmatized. And people, if they do get it, they do not talk about their experience. They try to hide it, that, gonna lay low. So I think unlike US, where you actually have a chance to talk about your experience, I think here it's very much repressed by your inner circle or by your surrounding. This is what I noticed talking with a couple of my colleagues who got infected, and I checked in with them just to see how they are. They just basically they don't want to talk, because they think there is always something, because there is always the underlying assumption that you did something bad and that's why you got it. That was my impression. So it seems to me that
it's about sickness in Serbia or in our context, because there is always stigma about sickness. Even if you get cancer, it's your fault somehow.
Yeah, I would
don't
agree
talk
with
about
that.
it.
And it can transfer to you. So if you
yeah, and it's
God
contagious.
forbid.
God forbid. Inshallah.
Inshallah.
Right. Next one would be, given the mistrust that Serbians are feeling towards public health officials, how do you anticipate people will respond to a vaccine treatment when one is finally announced?
Hey, we want Russian vaccines.
I don't even want to know. It's, yeah. There are many, like, even like when I talk even with like very well educated people who are not anti-vaxxers, they are very cautious about vaccines. And it's like, from my point of view, there will be like really huge debate here about the vaccines.
For example, I think it's not a bigger issue than it would be in US or, I don't know, Europe. I mean, because I think this anti-vaccination movement is kind of global. So I think just our region would follow global trends, right? Being part of this global society, I think we just fit into stereotypes. So I think there will be, as Ivan said, there will be a lot of talks about it, but I don't see this plays out
fashionable
in other regions either.
Yeah, this is, we are very into the fashion when it comes about stupid things.
Well, I think the last question would be, since Serbia and Bosnia-Herzegovina have had a history of collective mental health trauma and that people have experienced long periods of unrest with safety risks, I'm interested in learning more about the group community behavioral changes because of the pandemic. Are people hesitant to go outside, meet in groups, go to restaurants? Is social distancing happening? Also, are there any specific measures taking place to keep the older adult population safe?
Okay, I can just say something, and I'm boring, because my wife decided not to go out when we came back from the US for like a month. She didn't go out because here, I think social distance is not understood in the same way as it is in the US, right?
There is no such thing as a social distance.
So bars, restaurants, cafes, public transportation, there is no such thing as a social distance, right? I mean, what you can expect for people to wear masks, but basically that's about it. I think nothing else.
No, social distancing is too much for our culture. We have to touch each other. Yeah. So
and look into your bags when you are shopping.
So yeah, it would be very hard for someone from US to come and to actually go out and function, at least in this, because I think US people take this much more seriously, although people keep correcting me that it's not the same everywhere around US, but I think this kind of social distance and these measures are respected much more in the US than it is.
But do you guys have to sterilize when you are going into the shops? Our cinemas are closed.
To use a sanitizer.
Like
yeah, me too. Yeah.
Sanitizer, yeah, in front of the shops and stuff like this. For example, my dad, like most people are avoiding public transport. My dad is totally avoiding people. I haven't seen my dad now for 10 days because he doesn't want to spread COVID, just in case.
No, it's definitely like in the beginning of pandemics, 65 plus people were not allowed to go outside at all.
They were in the total lockdown. It was the same here, and that was, I think, in my opinion, the worst possible thing.
It was the worst case scenario for them.
Yeah, because like, actually the best like building up immune system, you need sun, you need D vitamin.
No, like all these like, I don't know, barbaric measures they took place in the beginning of pandemics in Serbia and Bosnia were really like out of mind. And that's why people reacted so furiously at some point. But now like there is no restriction, but older people are really taking care of themselves. Like I also didn't see my mom for now 2 weeks for the same reason.
So she's ignoring you as well?
Probably, I guess. That's a good excuse for not seeing me.
So I think we will have to talk to our parents.
We should, yeah.
Yeah. Yeah, so no special measures except locking them down. That was the only thing that they did for elderly. But we organized in Sarajevo, we organized something called Solidarity Line, and young people and volunteers were helping elderly, so to get them some medicine, to get them some food, to go shopping for them and stuff like that. And this line is still working. So I think this will go on. So.
All right. Well, thank you very much for all these very interesting answers, Ivan, Nemanja, and Maya. Peter, do you have any ending words for the end?
No, I think we have to wrap it up now. It's obvious we could go for 3 hours if we had the time and energy for it. But I thought this was just wonderful, and thanks especially to Ivan, Nemanja, and Maya for joining us and for talking with us about all these really complicated issues. It was really enlightening, and for me, and I'm sure it was for our audience as well. So thank you very much to everyone.
So yeah. Thank you too, and I hope I'll see you all soon back in Sarajevo.
Great, thanks everybody. Let's give a round of applause for all the speakers today. We have another webinar series, part of the series next week on Guatemala. Not sure exactly what the topic will be, but it will be really related to Guatemala. So thanks everybody. Enjoy the rest of your day and take care. Good to see everybody.
Thank you so much.